What you see in this video?
Yes, in this video, I can see a child in hospital setting. He looks alert, and on his gait examination, there is unsteadiness of gait with lateral veering, and his arms are flying, looking for the balance, and there is a wide base gait. And on skin survey, there is cluster of the vesicular lesion with erythematous base on his back, and some lesions are crusted and some are not.
So, what is the case and diagnosis, DD?
Yes, it's acute cerebellar ataxia, probably due to varicella zoster, and it may be caused by any toxin such as antihistamine, ethanol, any anticholinergic drug, brain tumor, neuroblastoma, and acute demyelinating encephalomyelitis.
Yes. So that is the case we are seeing, that is abnormal gait and there is crusted rash. In exam task, how it comes, the kid is playing with a Lego. There is poor coordination. This diadochokinesia, this metria, there is healed varicella rash. So rash and abnormal gait. So we go choosing post-viral cerebellitis. So it is a case of unsteady gait. The DDR acute and chronic, acute or post-viral varicella cerebellitis. Any drugs, labyrinthitis, acute disseminated encephalomyelitis, Guillain-Barré syndrome, and trauma. Chronic cerebral palsy, Friedreich ataxia, ataxia telangiectasia, Wilson disease, and vitamin deficiency. So, what history would like to ask in this patient?
Yes, onset, progression, is there any recurrence present or not, any prenormal illness with or without exanthem, any CNS symptoms, systemic inquiry, any eye involvement present or not, any speech difficulty, hearing, any hearing difficulty, any headache, weakness, any part of the body, and medication history, surgical history, and immunization history.
Yes. So, the history would ask that onset, course, and duration, what make it better and what make it worse. As usual, history of any preceding viral infections, any skin rash on the body, any cranial nerve affections, any history of headache, vomiting, especially at morning, and other sign of increased intracranial pressure, ear pain, any change in behavior, any history of any chronic illness or immunodeficiency, as we know, CP1 keep some ataxia we are keeping, history of any trauma, drug intake, drug that we know oculogyric crisis. And then no oculogyric crisis only eye movement present. Okay, family history of similar conditions, developmental history and school performance. These are we are asking. What examination we do?
Yes, we will do the general examination, vital sign, skin survey, and examination of the gait, tone, power, reflex. Is there any tremor, dysdiacokinesia, dysarthria present or not?
Together it is
Need
neurological
taken.
examination
Okay. Okay. Yes, it's neurological examination.
or anything.
Yes,
So,
neurological examination, and also the skin survey, and yes, skin survey and the general examination, and yes, cerebellar examination.
so we do the ACS airway breathing circulations, hydration status, consciousness level. Then neurological examination, everything we are doing, like coordination. We examine the cranial nerve, especially fifth, seventh, and eighth. Any telangiectasia over the eye, a speech pattern, and rash. And what investigation we do for varicella cerebellitis? Suppose it is a post varicella cerebellitis.
Yes, in case as if it is post varicella cerebellitis, no need of any investigation.
Anytime it's needed, when we
Okay,
do.
if yes, if there is any severe, and if it is progressive, or we are suspecting other differential diagnosis, so we can do the brain imaging MRI after discussion with consultant.
Yes. So we remember that there is no investigation needed for post varicella cerebellitis. And if condition is deteriorated, not improving after 48 hours, then we talk with our consultant. Full blood count CRP if infection if still present, and brain imaging or LP if there is any no contraindication unless. So we need to talk with the consultant. And what is the management we give?
Yes, we'll take the detailed history, appropriate examination, proper examination, and then we will educate and reassurance. And usually, no treatment is needed for this ataxia, and full recovery usually occurs within 10 to 21 days. And if ataxia is continued or disabled, so we can give the IVIG corticosteroid plasma exchange.
And multidisciplinary team involved with neurologist, speech and language therapist,
Yes,
social worker,
yes.
family support, school, lies with the school, and psychologist. These are the common sum we tell. And actually, post-viral cerebellitis, it is resolved spontaneously, does not require any treatment. But if it goes about 2 to 3 weeks, any medical advice, what medical advice give the patient when to seek medical help?
If the it is progressive and not improve within this within 2 months, so and if there is involved other, yes, it is not improving, and I'm not sure.
Okay, I'm telling you are
Yes.
okay. If it is not improving after 2 weeks, it is not 2 months, 2 weeks. If ataxia return after it has gone away, if the child develops high grade fever, become confused, irritable, if develop abnormal movement, if develop severe neck pain, fever, severe headache, if condition is severe, not improve after discussion with consultant, may advise. So condition is not improving after 2 weeks mainly. Then other features like the ataxia again come back, high grade fever, become confused, severe neck pain, headache. Then we'll discuss. And IV immunoglobulin and plasmapheresis. When it is not improving, then we give this. So this post-viral cerebellitis comes on history. It comes last year, maybe UK, same history, same management. If we know, we can do that management. Thank you for this history.